events in the health community. I think all of us, though, regard our health professionals as smart, caring people who generally do their best. And I think all of us realize they're not gods. I think we've heard the patient described up here with all the visits. All of us would be concerned about that patient. How could any doctor, any hospital, have a favorable outcome for that patient? I think we can be concerned about the deaths, the accidents, but we also we hold our doctors and our hospitals accountable for unfavorable outcomes. There is no doctor, no hospital could have given a favorable outcome to that patient. Therefore, I believe that we should have tort limits. If I don't want to play the Powerball, I'm not asked to pay. I don't have to pay. But when we have unnecessary tests, the doctors can't rely on their common sense what tests they should run. They have to run excessive tests to protect their well-being, their behinds, as they say. That adds to the cost of all those tests, of all the record keeping, and I really believe that's something that we should relook.
Great. Thank you very much, sir.
Appreciate your question. Before I went to Congress, when the Republicans were in the majority in Congress and George Bush was president, they went to the Congressional Budget Office, they went to the General Accounting Office, and they went to the Institutes of Medicine, and they asked them to study exactly what you're talking about, sir. That is the cost of defensive medicine and the impact of medical malpractice on the health insurance costs that we face in this country. Each one of those studies came back and estimated that the total cost of what you're talking about was somewhere under 1.5% of all healthcare costs in this country. And they also concluded that by imposing the types of restrictions that you're talking about, it would have absolutely no impact on total healthcare costs in this country. And there's a reason for that. I'll give you an example. Texas, which when President Bush was governor of Texas, passed some of the reforms you're talking about to eliminate quality of life damages for people who have been severely injured or killed due to medical negligence. They went back a year later and 2 years later and surveyed the hospitals and physicians in Texas. And not one of them reported reducing their fees in response to having a better environment for medical malpractice. One of the other things we know is that the insurance companies who provided insurance to those physicians did not reduce the premiums they charge after those restrictions were put in place. So the big driving factor in all this is, what do you have to pay for insurance to cover you for those types of claims? And if the insurance companies are not reducing their premiums, then what benefit is it to the physicians who are being held accountable for those problems? So there's a history of this, and if you go back, I can provide you with the studies. That's one of the reasons that there's no assurance that doing this is going to bring about the result that you're talking about.